It is one of those instant heart drop moments for any parent. You are gently brushing your child's hair, and suddenly there are just far too many strands coming away in the bristles. The immediate natural instinct is to panic. You might wonder if you are doing something wrong, even though you are likely putting in immense effort at the dinner table, making sure they finish their spinach, cooking kidney beans, and offering nutrient-dense snacks like dates. This leads to a deeply frustrating paradox. Even when the correct nutritional inputs are entering the body, specifically iron, the physical results aren't showing up where they matter. To solve this, we have to look past the scalp. The health of a hair follicle is determined far below the surface, rooted in the composition of the bloodstream. In many cases, the child isn't suffering from a lack of food. They're experiencing a systemic biological bottleneck, an absorption gap, that starves the body from the inside out. This diagram shows bioavailability, the difference between eating a nutrient and absorbing it. Notice how rigid iron particles bounce off the cellular barrier. They pass through unabsorbed, leaving the bloodstream empty. Without iron reaching the scalp, hair follicles weaken and detach. Ultimately, serving an iron-rich diet doesn't help if the body's internal environment isn't chemically equipped to process it. Changing that environment requires a simple chemical addition, ascorbic acid, commonly known as vitamin C. In this animation, watch the interaction. Vitamin C molecules enter and bind to the stubborn iron particles. This reaction transforms the iron into a fluid form that passes through the intestinal barrier, entering the bloodstream. You can trigger this reaction on the dinner plate in exactly 1 second. It is the lemon trick. By squeezing fresh lemon juice directly onto iron-rich meals like ragi or spinach, you create this chemical pairing before the food is even consumed. If lemon doesn't fit the meal, adding an orange to the child's fruit basket ensures a steady supply of vitamin C throughout the day, supporting the absorption of the iron they eat during their main meals. This 1-second dietary adjustment bridges the absorption gap, making the iron in their diet significantly more effective at reaching and fortifying the hair follicles. But digestion is only crude of the equation. Does your child snore? If they do, we have to consider the oxygenation factor. Hair follicles require a steady supply of oxygen delivered through the blood to stay deeply rooted. This cross-section shows how snoring creates a mechanical bottleneck. Enlarged adenoids can partially block the airway, which physically reduces the volume of oxygen entering the blood during sleep. When a child is experiencing both snoring and hair loss, they should be evaluated for enlarged adenoids by a clinical expert. Solving the nutritional gap is only half the battle if the biological system is also struggling with reduced oxygen levels. Beyond these internal factors, the biological system relies on a few consistent environmental inputs to maintain healthy growth. This includes the sun habit, 15 to 20 minutes of outdoor play for vitamin D, and maintaining a steady intake of calcium through foods like milk and eggs. Hygiene also plays a role. Washing the hair 2 to 3 times a week and changing pillowcases every 4 days helps prevent surface fungal infections that can damage the scalp. Sudden hair fall is an early warning signal from the body. It indicates that something in the chain of absorption or oxygenation needs attention. By utilizing the lemon trick and addressing these biological needs, you are providing the internal environment your child needs for their hair to grow back thick and healthy.